hospitals are losing money in claims because they neglect one simple concept. You will not believe this. You will even say it is not that important. Hospital leaders neglect that PhilHealth is an insurance organization. Have you ever heard your hospital top management say that DSWD and PCSO pays better? Let me clarify this. PhilHealth does not give social assistance or social programs. That is the DSWD. PhilHealth does not provide charity programs for health. That is PCSO. PhilHealth versus DSWD and you have versus PCSO is like comparing apples and oranges. PhilHealth operates as a social health insurance corporation. Now, the right way to understand PhilHealth, okay, are these things. First, okay, do you have a feeling that they are overprotective of the funds? At times, it seems they do not want to pay your hospital. It is because they are overprotective. They will protect the funds. The funds are not free. A big part of PhilHealth funds comes from members' premium contribution. So PhilHealth funds are public funds. The money is limited. It is hard-earned people's money. So PhilHealth must use it properly. They will not waste it on health services that are ineffective or unclear. If your hospital claim is lousy, poorly done, it is unclear to them. It is a waste of their time. It is a waste of public money. They will not pay you. So, make a good claim. Fund sustainability is their priority. They will not give it as assistance. They will not give it as charity. It is never free. Second, they will only pay for quality services. You admitted patients, services were given, your doctors and staff and top management must ask themselves, are we giving quality services based on PhilHealth rules? If not, do not bother to charge it to PhilHealth. Now, since it is hard-earned public funds, it must be used judiciously. Quality service means services based on standards. What is quality service for PhilHealth? So, health services must be based on clinical practice guidelines or CPG. Your resident doctors, consultants, clinical departments must adhere to commonly accepted standards or CPG. Be it pneumonia, COVID, dialysis, appendectomy, cesarean section, okay? They want to see clinical management aligned with CPGs. Laboratory, diagnostics, medicines, procedures done must be aligned with the CPG. This is important. The proof of quality services or the parts of the CPG must be written in the documents that you transmit. It must be seen in the CF4, the CF3, the OR technique. It must be seen in the clinical chart or the lab results. They must adhere to the CPG and parts of it must be seen in the chart or PhilHealth forms. So let's go to the third. Hospital leaders have known this for years. As an insurance organization, PhilHealth will do claims medical audit. Due to laziness, due to poor leadership, due to incompetence, review of claims prior to submission is not done by many hospitals. pre-screening of claims is not common in many hospitals. They know pre-screening is important, but they do not act on it. So claims audit or claims utilization are inherent in any insurance organization. They will review your claim if services are based on specific standards. This is the purpose of CF4. You have the medical post-audit, you have claims profiling, and there is even a pre-authorization concept. If they are not happy with your claim, okay, you will have no payment. So, the 3 action steps for you and your hospital. Okay? Action step number 1, educate and train your staff. Okay? Training sessions for your medical and administrative staff is a must. It is to ensure they fully understand that Philhealth is a social health insurance company, not a provider of assistance or charity programs. Now, emphasize, okay, the importance of using Philhealth funds judiciously, okay, as they are public funds derived from members' premium contribution. Action step number 2, adhere to clinical practice guidelines. Okay? Implement strict policies that all health services, including laboratory, diagnostics, medicines, procedures, are aligned with commonly accepted clinical practice guidelines. Regularly review and update hospital practices in line with the latest CPG for various treatments and procedures, be it like pneumonia, stroke, sepsis, appendectomy, or cesarean section. Okay? So, action step number 3, prepare for claims medical audit. Develop a comprehensive internal audit system to preemptively check if all claims meet a specific standard set by Philhealth. So, establish a protocol for handling returned, for handling denied claims, or those that go to Philhealth Legal, ensuring non-compliance issues are quickly addressed and rectified. Now, hospital leaders must have a full grasp on the concept that Philhealth is an insurance organization. They are not like DSWD nor PCSO. So let me simplify. Okay? If your leader, okay, understands Philhealth as an insurance organization, then your leader knows that Philhealth funds must be used properly. Proper use of the funds means Philhealth will only pay for quality services. Now, this means every service that you charge to Philhealth will undergo a medical audit. So, your medical audit is all about the CPG audit. Now, unfortunately, many hospital leaders neglect this concept. Your leaders or top management must take steps in reducing risk of losing money in claims processing. If you want to make money, your leaders must enhance overall effectiveness and compliance of hospital operations with Philhealth standards as an insurance organization. That is how you fix your claim. This is Coach Doc Ben. See you in our next session.